Hey, thanks for joining Dr. Wood and I for a chat. We're talking about when is a good time to be intimate with your partner after having a baby. Now, I know I'm taking this one for the team because we have a closed Mums at the Table Facebook group. So a lot of women were asking about this. So when is a good time to get intimate with your partner after having the baby?
After the baby. Okay, so I guess it depends. If you've had a caesarean section, you know, you need to wait till your abdominal muscles have all healed well.
Right. And when would that be?
Well, look, I would say normally about 6 weeks' time.
And that's usually when you've had your
postnatal check.
Yes.
There's no rules about this, you know, and it really depends on how you feel.
Right.
It's usually pretty impressive if people have had time to have intercourse at this stage.
Yeah.
Because most of the time they're really tired because they're looking after a new baby. But if that's where you're at, that is a brilliant thing.
Okay.
When after you've had a vaginal birth, things are a bit different down there.
Okay.
You may have had some stitches, you may not have had any stitches, but either way, things are swollen and just need time to recover.
Yeah, how long?
And
6 weeks, 8 weeks?
I got to say, it's a variable time. If you have had some stitches, it would be good to wait at least 6 weeks for that to fully heal.
Maybe even a year.
Yeah, that's a possibility.
Yeah.
That's a good form of contraception as well. But you know, and so you're going to see your obstetrician for your 6-week checkup, and they usually, you know, check you to
They'll
make
be
sure
able to tell you what.
But there's a couple other things I want to talk about this particular thing, and that when you're breastfeeding, your natural levels of lubrication in your vagina are going to be reduced.
Oh, is that right?
Yeah, because
I still felt pregnant.
Yeah, it can happen.
I was breastfeeding right up until, so it wasn't a very good form of contraception because I heard
about 3% of people can fall pregnant when they're breastfeeding.
Right.
So some people are very blessed. That's right. But your natural levels of lubrication are going to be significantly reduced. And so for that reason, it's a good idea to use extra lubrication if you're still breastfeeding, and particularly if you've had some tear or some repair work done after the birth. So those are important things to use. And when you're talking about contraception, if you're using condoms, then you need to use a water-based lubricant. But if you're using, say, other forms of contraception, hormonal contraception, then you could use an oil-based. And one of the things that I find my patients find very popular is to use coconut oil, which you can buy at the supermarket from the cooking section. Very healthy for your skin.
So if you've got time for this, go get some coconut oil and get lubricated and whatever the situation might be.
Whatever you need.
I think what I'm hearing from you is to get checked from your doctor prior to engaging in...
But I think it's an individual thing. I mean, some people will be ready to do it earlier, but it's really... There's a lot of emotions involved with returning to intercourse, you know, and... You might be tired, you might be looking after a child, and so that might not have been on your radar for quite some time.
I heard you could be more susceptible to getting pregnant easier once you've had a baby if you do.
I don't think there's any evidence about that. I think it's more to do with, you know what your body's going to go through again. So there's that sort of aspect of things, but I don't think there's any evidence that you're likely to fall pregnant easier next time. It could be for some people, but...
Thank you so much, Dr. Wood, for those tips. I hope that's helped you, ladies. Keep it locked right here for more of this information and so much more. Mums at the Table.